Lifestyle and inflammation. In this presentation, I'm going to discuss what inflammation is, how it starts, and our inbuilt protection. How diet may protect us, how sugar, fat, and stress can set off inflammation, a guide on buying, cooking with fats and protecting fats, and finally, what supplements can help to reduce inflammation. Now, firstly, what it is. There's 4 elements to it: pain, heat, swelling, and redness. It can happen outside the body or inside the body. That lower one is the stomach ulcer. There's an element of inflammation in most of the conditions that you will read about or suffer from, because the very first thing that your immune system does is it creates an inflammatory cascade. So there is a trigger, and this trigger can be an injury, it can be a viral or a bacteria attack, it can be a chemical agent, and your immune system responds. But it can also be lifestyle factors like chronic stress, poor diet, low antioxidants in the diet, and a sedentary lifestyle. It doesn't really matter what the trigger is. There's 3 steps to inflammation. The very first step is that the blood vessels to the area of injury dilate, and a lot of blood comes to the area, so it gets warm, bringing with it white blood cells who produce histamine that make the blood vessel walls more permeable, allowing more cells to enter that area and exiting the blood vessel. The damaged cells and the white blood cells produce chemicals, prostaglandins, leukotrienes. You'll have heard of cytokines, and this affects the nerve endings in that area, and that's what causes the pain. Then the final step of inflammation is repair to the area. But sometimes inflammation does not shut down, and this is where we ask ourselves, can diet help? So the damaged cells that produce cytokines use fatty acids that are on the cell walls in that area. And that fat comes from the foods that we eat. So there's a cell. You can see the little yellow tails. They're the fats that you eat in your diet. And those fats can be a mix of saturated fat or unsaturated fat. The unsaturated fats can be omega-3, 6, 9. The thing about these is that they either promote inflammation or dampen inflammation. They tend to be, you need a balance of fats in your diet. So saturated fats promote inflammation. Omega-3 dampens inflammation. Too much omega-6 promotes inflammation or overwhelms omega-3. Saturated fats here on the left, they tend to be solid at room temperature. So butter and lard, coconut oil, palm oil, or you can even see them on animal products. You need a certain amount of saturated fat, but it's when you have too much, that's when it's unhealthy and can make inflammation continue within the body. Monounsaturated fats, they'll have all of the 3. They'll have saturated, mono and polyunsaturated fats in there, but they tend to have more of the monounsaturated fats, and they've been shown to be helpful at reducing inflammation. There's 4 of them: olive oil, rapeseed oil, peanut oil, and macadamia nut oil. They're liquid at room temperature. The polyunsaturated fats are also liquid at room temperature, and they're a very good source of omega-6, which is an essential fat. The thing about it is, that's more vulnerable to heat, and this fat tends to be used a lot in the ready meals that we buy, and it's really not suitable for high heat cooking. There is another essential fat, and this is the one that has been shown to dampen inflammation, and that's omega-3. Your body can't make it. It has to get it from food. So do you eat oily fish? Mackerel, herring, sardines, salmon, trout, halibut, anchovy, tuna? Do you eat leafy green vegetables and put plenty of herbs into your meals? Do you eat the likes of nuts, especially walnuts, seeds, especially flax seeds, soybean, maybe even avocado? It has a little bit of omega-3 in it. So if you don't, the best source is by far the oily fish. And if you don't take oily fish, a supplement of a fish oil containing EPA and DHA, they're the 2 fatty acids, would be worth trialing to see if it helps to reduce inflammation. Another strategy is to investigate how much saturated fat are you intaking into your diet at the moment. So saturated fat, again, you can recognize that they're on the animal products, but also dairy. And just be conscious of what dairy goes into. So milk goes into the likes of milk chocolate. Cheese goes onto pizza, into lasagna, and then butter. Butter goes into croissant. It goes on white bread. It goes into pastry for desserts and for pies. It goes into scones. And what I see is that a lot of these foods are trigger foods, as in my clients eat a lot of them. And then you have the likes of cream and sugar combining to form ice cream. Great strategy is to just swap out the fats. So if you look here at the saturated, monounsaturated and polyunsaturated, right? A good example is butter. 100 gram of butter has 52 grams saturated fat. Swap it out for almond nut butter, which only has 6 grams of saturated fat. Swap a beef steak for a venison steak. Swap a chicken liver pate for a hummus. And then cheddar cheese, I do have it on my program. Good source of calcium. It is filling, but portion control it. And every now and again, swap it out for my other recipes, the trout pate, the salmon mousse, or the mackerel pate. Section 2, protection. What foods do we eat that protect us? Because every time we eat, we create a fire. You can actually feel warm after eating, and we have to eat to live. When we excessively eat, too many calories, or drink too much alcohol, or get a viral attack, it creates oxidative stress within the body. Now, what is oxidative stress? A good example is if you take an apple or a tomato, chop it in half, leave it out just at room temperature, but put lemon juice over half, not the other half. And notice how the lemon juice will protect it and stop it from going brown for longer. So there's certain foods that do that exact same thing inside our body. And when there is oxidative stress there, the antioxidants will dampen down the ferocity of the fire. Another great strategy for dampening free radicals or oxidative stress within the body is time-restricted eating, known as intermittent fasting, or just reduce your overall calorie intake. If you move more, you will ensure that you have an excellent oxygen saturation to all of your vital organs. And if you lose weight, that certainly will help to reduce inflammation. My clients tell me they have less aches and pains when they lose weight. This journal here stated that obesity is a state of chronic low-grade systemic inflammation. In other words, your GP's blood test won't pick it up, but it's there. It's aches and pains all over your body. What's obesity? It's a body mass index of over 30. There is inbuilt protection. The liver is the most important one. So are you minding your liver? Alcohol being probably the most damaging to the liver. Then there is enzymes, but they need nutrients for them to work properly. And if you'll have a look at the 4 big enzymes here that are used to keep the body healthy, they need zinc, copper, manganese, selenium, and iron. So, in other words, are you eating healthily every day? Your primary antioxidants, so the key ones that put out the fire, that reduce the oxidative stress, are vitamin C, E, and A. Take a look there at the foods. Now, there will be other foods, but these are a particularly good source of these nutrients. I don't promote liver, and I portion control whole grains. Everything else you're getting on my program. Then there's a family of plant nutrients. Phytochemicals they're referred to. The first family are flavonoids. They protect fats from being oxidized in the body. So they'll stop an immuno-triggered inflammation cascade. You'll recognize them by their colour. They're red, they're purple, they're green, they're black. And if you take a blackberry and squish it up in your finger, you'll notice that it stains your finger. And this is the compound that you want in your body. It's the pigment. It's in the skin, seeds and leaves of these foods. They dissolve into blood, into anything, they're water soluble. There's another family that dissolves into fat, and you want to actually protect those fats that are on your cell wall. You'll recognize these by their colour again. They're predominantly orange and red. You'll recognize the name as well, alpha carotene, beta carotene being 2. And again, they're the pigments. So if you can buy organic and leave the skin on food, that is useful. So bottom line, your diet will be rich in antioxidants if you can get as many colours as you can onto your plate. That's an easy way of knowing if you're getting a high antioxidant diet. Third section, nutrition. Stress. How does it set off inflammation? Well, there's your immune system. And your white blood cells patrol around the lymph system there. They pop out of the lymph into the blood, into the tissue, keeping an eye on what's happening. But when you're stressed, your immune cells are quietened. They're suppressed. When the stress declines, your immune system kicks back in, but it might overreact. Could be a little bit jittery. The question to ask yourself is, when you go away at Christmas, when you take a holiday, do you tend to get sick? That could be something to ask yourself. Now, a high sugar diet damages because when it goes into the bloodstream, it bumps off all of the other things that are in your bloodstreams. And there's proteins and there's fats and there's red blood cells. And it causes a thing called glycation. And this leads to the formation of AGEs, AGEs, advanced glycated end products. Imagine this journal went so far as to say that if you could inhibit the formation of these ages, you would increase your lifespan. So how to avoid them? Follow a low-carb eating lifestyle. That's less than 130 grams of carb per day, and I think we all know where the sugar lies. Whole grains are a healthy food, but portion control them, because I just find that my clients tend to overeat them. Again, when you're looking at the bloodstream, if there's too much fat, too much calorie, and people are sitting around, the blood flow slows, the blood thickens because there's so much within the blood. And this can lead to a damage to the fats that are within the blood. And then you're dealing with an OL, an oxidized lipid. That's another trigger to the immune cells. They don't like to see them there. So just reminding ourselves, you can eat oxidized lipids rather than it happening in the body. So if you take an animal product that has fat in it, like a meat or like an egg, and if you overcook it or burn it, you're damaging the fat and then eating it. If you toast nuts and seeds and burn them, you're eating an oxidized fat. If you're crisping up something using an omega-6, like a crisp or a nacho or chips, you're eating oxidized lipids. And then the other fats, the saturated fats that we mentioned earlier. That's just too much fat in the bloodstream. So our immune cells, they don't like ages. They don't like oxidized lipids. They spot them, they set off the inflammatory cascade. There's another visual of your immune cells spotting something it doesn't like. The OLs there, they're the little orange balls down there on the left, and they set off this cascade. How do you avoid them? Antioxidant rich diets. So sometimes you might think, well, I eat crisps and I eat chips. But if you can just balance that out by making sure that you're getting plenty of vitamin A, E and C, carotens and flavonoids. So keep the healthy diet going even when you're treating yourself. Don't overeat at any one meal and practice the intermittent fasting. Daily exercise, keep moving. So guidance on buying and cooking with fats. So if you're buying a fat and oil, make sure that it's in a dark bottle, tightly sealed, away from the light in the cupboard, because when they're exposed to heat, light or oxygen, they go rancid. So smell it before you use it to make sure it's not gone off. If you're cooking at a high spitting heat where it's jumping off the pan, you're best to use a fat that's more stable at high temperature. So that's your saturated fat, butter, palm oil, coconut. If you're using a small bit of butter, that's okay, because you need a certain amount of saturated fat. But if it's a little bit more and you're doing high heat cooking often, well then the saturated fat that's in coconut oil, it has more short and medium chain fatty acids, and that's better burnt by the liver. There's a reminder to avoid burning foods that have fat in them. Then if you're baking, stir frying or sauteing, use the mono unsaturated fats, and your 4 ones there in order of macadamia nut oil, rapeseed or olive oil. Now the reason why the macadamia nut oil is the first one is because it had a very low amount of omega-6 in it, even lower than olive oil. So firstly macadamia nut, then rapeseed, then olive oil for moderate heat cooking. Then when you have a salad dressing or if you're buying a mayonnaise, make sure that there's an omega-9 in it. Never heat an omega-3 oil. That'd be the only one is flaxseed or linseed oil. That's just to show you deep fat frying, how the oil foams and the colour darkens. I mean, if you were to eat that cold, how would it taste? How would it smell? Then there's certain foods that will contain potentially damaged fats, oxidized lipids, like crackers. So I recommend the Foods of Athenry or the water-based crackers because they don't have a sunflower oil in them. You'll see the two at the end have an omega-6 oil in them. There is not a healthy crisp. So crisps, all of them, I went through all of the packets, they use an omega-6 oil. You'll see sunflower in the two there. And when you look at the like of Pringles, monosodium glutamate, that's an addictive substance. And they even promote that, saying once you pop, you can't stop. Just stay away from crisps. Biscuits used to use an omega-6 and then they switched over. I found when I did my troll through the supermarket recently, they're now using palm oil. But there's an issue with palm oil. Dark chocolate's a much healthier treat. Worth looking at the label here, I discovered, because Manhattan uses a saturated fat coconut, so that's more stable at high heat, whereas the other brand is using a sunflower oil, so there would be oxidized lipids there. Baked goods are just not good for you, but a slice of birthday cake is okay every now and again. Check with your ready meals and your sauces what fats are in there. And with your takeaways, well, you're getting oxidized lipids. But again, on occasion, and if you've enough antioxidants, that will protect you. It's all about balance. So There is a series of foods that keep on coming up in terms of helping to control blood sugar or manage cholesterol or just protect the body. And they're there. There's a visual of them for you. Nuts and seeds, really good. Good combination of all the different types of fats in there with sterols to protect the fats. There is supplements that you can try if you have active inflammation in the body. Alpha-lipoic acid. Check with your GP to make sure now these compounds don't interfere with any medication that you're on. N-acetylcysteine helps to boost a compound called glutathione. And glutathione is a really powerful antioxidant that's in the liver. These two are good for cardiovascular health. Evening primrose oil, superb for fibrocystic breast disease. Milk thistle, good for the liver. Curcumin from turmeric, seemingly very good for joint pain. I've heard that from quite a few people. Aloe vera, good to apply on your skin for flare-ups like sunburn, or to drink for soothing a sore belly. There's 5 herbs that may be helpful, but I'm not a herbalist. And then extreme cold and heat. So if you have inflammation somewhere and if you put one of the topical, like the likes of Etoflam on it, that can calm it. So heat on heat, and for some people, cold on heat, like sea swimming. And it can give you a little bit of a break from active inflammation. You can go to your GP and you can get tested, but as I said earlier, a BMI of greater than 30, it's chronic, but it's very low grade, so it mightn't be picked up in the bloods. Here was an interesting conclusion from a study that I read a good while back. So in summary, a low sugar, low carb, active lifestyle helps to reduce glycation, keeps all your cells and your organs well, balance your fats, make sure you're getting your omega-3, make sure you're not getting too much saturated fat. Antioxidant rich diet, because there is going to be oxidative stress in the body. Just make sure that you have enough antioxidants to balance out the free radicals. Learn to manage stress. And finally, there's trillions of gut bacteria living in our gut. They communicate with the immune cells. In our younger years, they help to establish tolerance to stop our immune cells from overreacting to new foods that we're trying as kids. Now, they eat fiber. So if you feed a high fiber diet to your gut bacteria, that will help to maintain a healthy immune system. Thank you for listening, and if you have any questions, feel free to email me.